Greetings. Welcome to my YouTube channel. My name is Mushtaq Memon, Professor Emeritus from Washington State University. Today we are going to talk about male reproduction, which is the other half of the reproduction. So it will be focused on the bull and bull reproduction. This is where most of the research is done when it comes to the male domestic animals. So when we look at the male and female, for instance, we'll find out that male is easy to evaluate. And part of the reason is that in our situation here in domestic animals, the testes, the gonads of the male are outside the body, having easy access for us to check them and do different diagnostic tests if we have to. As you can see in this situation, these are the two normal testes. Pendulous in the scrotum of the bull. Whereas if we look at the female, her gonads, ovaries, are inside the body, which has got not easy access to really feel and, look for that matter with ultrasound and things like that. So I think it's important to make sure the male is okay before you try to use it for breeding purposes or for semen collection. So other reason is that male is so important because there are fewer males used for breeding many females. So again, it becomes another important feature that male reproduction ought to be considered. And male evaluation should be done before the male is put with the female for breeding purposes. So this examination or evaluation is called breeding soundness examination, which has different parameters that we try to look a little more closely here. So different aspects of breeding soundness examination, as you can see here, are physical examination of the animal, which would include obviously reproductive exam. Then we measure the scrotum. As you can see here on left-hand side the picture, that how operators holding gently these testes down and then applying this measuring plastic tape around the testes to see how big these testes are. And the reason this measurement is so important, because in all domestic animals that we know of, we have found that the size of the testes is positively correlated with the sperm production. Now, what does it mean? It means that bigger the testes, more sperm that animal produces. So I think this is why this measurement is so important. And then we collect semen from these animals and then go through the battery of tests: semen, sperm motility, morphology, concentration, and so on and so forth. So I'm going to share with you a case study which I did a few years ago in country Oman. This is where I was doing my Fulbright Scholar Fellowship. And Oman, as you can see on the map, is located in the Middle East, next to United Arab Emirates and Saudi Arabia. And here there were 11 bulls utilized for breeding 30 cows. This was natural breeding. So these bulls were turned loose with these cows to, breed them. And so I said, okay, we are going to do this breeding sound examination and all, these 11 bulls. So the criteria on the breeding soundness examination is that we have 3 classifications. If the animal turns out to having all those things fulfilled, means normal scrotal circumference, physical exam is okay, and the sperm examination is satisfactory, then we call this bull, he is a satisfactory potential breeder. And then if animal has a condition that we think is not a good thing to have this bull be bred, then would be classified as unsatisfactory. Then in the middle is what we call deferred classification. Now, this is reserved for animals that we know that they can improve. You may have a younger bull, will have fewer sperm or may have a few more abnormalities, that you want to give them a break. So say, let us re-examine this animal after, 4 or 5 months or so. So those are 3 classifications. So if we look at this table, which shows the results of these 11 bulls breeding soundness examination, and you can see on the left-hand side all the way down is the bull identification number. After that is the scrotal circumference measurement. Now, in our bulls here in the United States, we have a kind of landmark that you have to have at least 34 centimeter scrotal circumference in 2 years or more than 2 years of age in the bull. Whereas in other countries, like in Oman, usually you have the males, which are zebu cattle, and our crosses of zebu, which usually have a tendency to have smaller testes, but they're normal. Then we see that the next column is sperm motility. We like to see at least 30 or more % of motile sperm. Then follows by normal sperm, or we look at the sperm morphology. So you've got numbers there. At the end is the outcome. So you could see here on this table there are 2 bulls. One is the first one on the top is number 1906, which was declared unsatisfactory because he had inguinal hernia. And I will tell you a little more about it. The second bull is the third in the row is 1941, which had azoospermia, means no sperm at all, and is ejaculated. So if I call your attention to this slide here, on left-hand side is the picture of the testes of the normal bull. You can see very nice, narrow scrotal neck coming down. There are 2 testes, pendulous in the scrotum. And then on the right-hand side is the bull which had inguinal hernia. If you please look at closely, the neck of this scrotum is much bigger than the normal you saw on the left-hand side. So why is it bigger? If you were there, like I was, and tried to feel with your hand, you will find that there is some mushy feeling to it. There's something in it which shouldn't be there. It could be part of the momentum or the part of the gut which had gone through the inguinal ring, which is bigger, obviously. So that inguinal ring allows that contents to come down, which is not normal. So that's why this animal was declared, unsatisfactory. And here is the findings on bull, which was azoospermic. Now, these are 2 test tubes that you can see here. The one tube on your left-hand side is the one which has got clear fluid in it. And the other tube has the milky white fluid, which is the ejaculate, which is a normal semen. This is how it looks like in a bull. Whereas the other one has a very clear fluid. So what we are looking at is this is a seminal plasma, which is a watery, clear fluid, has no sperm at all. By the way, we looked under the microscope and made sure. In fact, I collected this bull 2 more times just to make sure that this what I was looking at, it was azoospermia. So we again declared this bull. And if you are interested in more information about these bulls, I have mentioned the reference, which we published this paper, in Clinical Theory of Genealogy. Now, the next case report I'm going to discuss with you, which is here in the United States. And here, this is a map of the United States, as you can see. So out of 50 states, we have one state called Idaho. If you look at the Northwest, all the way up in the corner of the United States and the Northwest, as I mentioned, you see WA, which is Washington. Under Washington is Oregon, with the letters OR. Next to that is ID, which is Idaho. And next to Idaho is another state called Wyoming, WY, which I'll mention in a minute. So this farm had bisons. So this is called bison here in the United States. Some people even call it buffalo. This is why the buffalo which are in Asia and Africa, just to make sure we are not confusing bison with buffalo and buffalo with those buffalo from Africa and Asia. So they are called here water buffalo, the one which are in Africa and Asia. So these buffalo or bison are essentially really wild animals. But some people keep them on the farm because they like to see them, and they also, promote their lean meat and things like that. So here on this farm, there were 3 bulls which were there to breed 19 cows. So when we went there, these clients were concerned because with the 3 bulls with the 19 cows, they had only 3 calves born. So we went ahead and did breeding soundness examination. It was interesting that the older bull, which is, as you can see here, number 25, 4 years old, was azoospermic. I don't have to tell you any more details. What is azoospermia? Did not have this animal any sperm at all. By the way, I don't want to get you in details how this animal was brought in the chute and tried to collect the semen, which was itself a lot of big exercise. But the younger bull were okay. So we told the client that please do not use this older bull and try to use only 2, the younger bulls. We followed that the following year. The following year, when those 2 bulls were put with 35 cows, they had 23 calves born. And you wonder, what happened here? Well, I think the older bull was probably dominant on these 2 younger bulls. So situation is many times the older bulls have this dominance, and they would not let the younger bull come close to those cows, and he would keep on breeding them. And I think this is what had happened. So here, I think we were very pleased, along with the clients, that we made some dents here. And it shows you the importance of breeding soundness examination. So please keep in mind, I may just go ahead and give my 2 cents worth. Another thing, that the customary traditional view is that whenever a female doesn't get pregnant, we say, well, this cow is not pregnant. Why? So I think we forget the other half, which is a male. Please keep in mind that reproduction, evaluation of male is very important. So, but azoospermia and inguinal hernia are not the only conditions in bulls. There are some others too. And so I would like to share with you some of that information in my next video, as I've called here, Navigating Bull Reproductive Health, Insight into Common Disorder. So until then, I wish you well. So see you soon. Bye-bye.